very good morning. By way of introduction, I'm Mr. John Edwin. I'm a consultant orthopedic surgeon and I'm a shoulder and upper limb surgeon in terms of my subspecialist interests. I would like to talk to you about the anatomy of the upper limb. The upper limb is the functional unit of the upper body. It consists of three sections: the upper arm, the forearm, and the hand. It extends from the shoulder joint to the fingers, contains 30 bones. It also contains many nerves, blood vessels, which includes arteries and veins, and the muscles. The nerves of the arm are supplied by one of the two major plexuses of the human body, which is the brachial plexus. So, in terms of the structure and the function of the upper limb, the upper extremity begins at the shoulder joint. This joint is commonly referred to as a ball and a socket joint, although it is more of a very shallow socket. One has to remember that the socket is just about a third of the size of the ball. In contrast to the hip, the socket is much shallower. This, though, allows for less restriction of the movements, but it compromises the stability of the joint. The elbow joint is usually referred to as a hinge joint, although there is also an element of pivoting which allows us for doing the supination and the pronation movements. The wrist joint can be classified as an ellipsoidal or a condyloid joint. There are also joints in the carpal bones, which are referred to as the intercarpal joints. Even though these are synovial joints, they do not allow for much movements. The interphalangeal joints are basically hinge joints. Now we will talk about the different bones of the upper limb. One has to remember that the basic shoulder construct contains the clavicle in the anterior aspect, the scapula, the posterior aspect of the rib cage, which articulates together to form the shoulder joint with the proximal humerus. The 30 bones in total make up the structure of the upper limb. They act as a framework for the muscles, for the blood vessels, the nerves, the lymphatics to work on. The main bone that we need to talk about in this particular lecture is about the humerus and the articulation it forms at the shoulder as well as at the elbow joint. Pause. We will now talk about the anatomy of the humerus. The humerus consists of a proximal end, which is subdivided into a head, an anatomical neck, and the greater and the lesser tuberosities. The head is a hemispherical shaped structure with hyaline cartilage which covers the smooth articular surface. In the anatomical position, the head faces medially. It also tilts superiorly and posteriorly, where it articulates with the glenoid fossa of the scapula. The anatomical neck is a slight narrowing below the articular surface of the humeral head. This is the area where the joint of the the capsule of the shoulder joint is attached. We will now talk about the tuberosities. There is a lesser tuberosity which is further medial and anterior, and this is separated from the greater tuberosity by an intertubercular groove. This is of immense anatomical importance, which we will discuss subsequently. The greater tuberosity is the most lateral part of the proximal end of the humerus. It contains three smooth, flat surfaces, and this is forming the area where three of the rotator cuff muscles are attached. The muscles that are attached to these three impressions of the greater tuberosity, starting from anteriorly and going behind it posteriorly: one, supraspinatus; two, infraspinatus; and the third one is the teres minor muscle. Pause. Now we will discuss about the intertubercular sulcus. This is basically a groove between the two tubercles. Remember, we discussed about the lesser tubercle and the greater tubercle, and in between is this groove. This is a groove through which the tendon of the long head of the biceps, along with a branch of the ascending circumflex humeral artery, are located. This sulcus also consists of a lateral lip and a medial lip. This basically are bony projections which forms the attachments for two muscles, which is the teres major and the pectoralis major. So essentially the anatomy to remember is lady between two majors, where the lady is the L for the latissimus dorsi and the majors are the two majors, which are teres major and pectoralis major. Coming down to the surgical neck of the humerus, we have to remember that the surgical neck is a narrowing below the tubercles, and therefore it is referred to as the surgical neck. The importance of the surgical neck is that this is one of the regions which commonly fractures due to a mechanical fall. The other anatomical aspect one has to remember is that it is in close proximity to the axillary nerve and the posterior circumflex humeral artery. This is also the region where the proximal end of the humerus joins with the shaft. Pause.